Hi, I'm Deborah Beard and I'm a tutor for YMCAfit and an exercise and pregnancy specialist. Many PTs are faced with new mums who have no idea what exercises are safe for them to be doing. Without specialist knowledge, it can sometimes be a little tricky for PTs to know exactly what is right and wrong. So we're going to work your pelvic floor muscles, and the pelvic floor muscles are particularly important in pregnancy because they are in our bodies mainly to aid continence, okay, so to stop us weeing ourselves all day long. During pregnancy, you've got the weight of a very heavy uterus pressing on your pelvic floor muscles, so they're under quite a lot of stress. So the bigger the pregnant woman gets, the more stress is on those pelvic floor muscles. So as you can imagine, if you then start adding any impact to that or jumping, it's going to really weaken those muscles. The second thing to consider is during labour, providing you have a normal vaginal delivery, the pelvic floor muscles are actually going to be used as an exit. So the baby will come through the pelvic floor and therefore it's going to be widening and stretching the muscles. So there's all sorts of hormones going on in our body that help us to prepare for that and allow the pelvic floor muscles to do what they should do and hopefully go back to normal. But during our exercise sessions, we need to make sure that we're doing some exercises to help us along the way. So we'll start off with the fast ones, okay? So you can sit in any position that feels comfortable for you. So you might sit cross-legged or in any position that feels comfortable. You can do these exercises lying down, and you can also do them on all fours as well, on your hands and knees. So we'll do a few of those shortly. Okay, so for now, sitting up nice and tall with a straight back, I want you to imagine that you're about to cough or sneeze, yeah? And you think you might need to go to the loo as well. So what I want you to do is think about the muscles that you use to stop yourself going to the toilet mid-flow. And I want you to just very quickly pull up those muscles in between the front and the back passage, as if you're trying to stop yourself going to the loo. Okay, so squeeze up and then very slowly release. The other type of pelvic floor exercises that we need to do, like I mentioned, are the slower ones. So what I want you to imagine is that your pelvic floor muscles are like a lift in a tall building, and you're going to go up to about 3 floors, okay, in this elevator in a building. So again, thinking about the muscles that you use to stop yourself going to the toilet, and it's often useful for people to think about pulling up the front and the back passage at the same time, or maybe one quickly after the other. So front and back, okay? So we'll do it nice and slowly. So imagine you're going up through these floors in a building. So we take it up one level, and the next, and the next. Hold it, and then go back down again. So take it down a level, down a level, down a level. Ideally, you do these about 100 times a day, both fast and slow. The important thing to remember is that you always release slowly. So never just push out, never push. Always just think about slowly releasing the muscle. Another area that needs to be worked during pregnancy is the abdominal area itself. Now, when you're pregnant, it's not advisable after 20 weeks to be doing abdominal curls, which are the regular forward motion, forward flexion of the spine. Women need to be doing static abdominal work. So we're going to concentrate next on transverse abdominis squeezes. So we're going to get onto our hands and knees in a box position. So ideally you'd have your hands directly underneath your shoulders and your knees directly underneath your hips. Lovely, nice flat back. Now I know that you've done the plank many times before, usually on your forearms and your toes, but for now we're going to have to keep this fairly easier because if you were pregnant you'd have a bigger bump, yeah? All the same things need to be considered. So I want you to imagine that you've got your belly button being drawn towards the ceiling. So imagine something coming through your abs, pulling up through your spine, engaging your deep abdominal muscles. Imagine that you've got a really nice tight pair of jeans on that you're having to squeeze into, okay? And I want you to just hold it approximately to about 30% of your maximum effort. It doesn't need to be 100%. It should feel like you're able to maintain that position, okay? Just keep that abdominal area contracted, breathe naturally, and we're going to hold that for as long as you feel comfortable, okay? You may want to take a rest in between repetitions, and you can repeat the same exercise 2 or 3 times. I hope I was able to give you some useful advice, which you can now incorporate in your sessions with ante and postnatal mothers. If you want to really specialise in this area, then the ante and postnatal exercise course would be perfect for you.